Imagine this. Stepping into a surgeon's theatre in the 1800s, you wouldn't find sterile tools or modern equipment. Instead, you'd be met with the stench of sweat and fear, the air thick with tension and anticipation. Before the advent of anesthesia, surgery was a brutal affair, a test of endurance for both the patient and the surgeon. It's a chilling thought, but historians estimate that without anesthesia, as many as 80% of patients undergoing major surgery didn't survive the ordeal. The odds were grim. The cause? Not always the surgery itself, but rather the trauma and shock inflicted by unimaginable pain. The human body can only endure so much. The very act of holding a patient down during surgery, often with their limbs tied to the operating table, speaks volumes about the era. It was a desperate measure to keep them still. This was a time when pain was an unavoidable part of life, and death from surgical shock a common occurrence. The fear of surgery was immense. This harsh reality makes the development of anesthesia not just a medical marvel, but a profound turning point in human history. It transformed surgery from a nightmare into a manageable procedure, saving countless lives and changing the course of medical practice forever. Anesthesia, the practice of inducing insensitivity to pain, emerged as a beacon of hope in a world riddled with suffering. It revolutionized the field of surgery, offering a new lease on life to countless patients who would otherwise have faced unbearable pain. No longer would patients have to endure the agony of the surgeon's knife while fully conscious. The advent of anesthesia meant that complex and life-saving procedures could be performed with a level of precision and care previously unimaginable. Yet, the path to pain relief was paved with its own share of darkness and controversy. The early days of anesthesia were marked by trial and error, with many experiments leading to unforeseen complications and ethical dilemmas. Early experiments were fraught with danger, and the substances used were crude and unpredictable. Many patients and practitioners faced significant risks, as the quest for effective pain relief often led to perilous outcomes. The story of anesthesia is one of both triumph and tragedy, marked by accidental discoveries, daring experimentation, and the gradual shift in societal attitudes towards pain and the very nature of medicine. These breakthroughs not only changed the medical field, but also altered the course of human history. It's a testament to human ingenuity, but also a stark reminder of the ethical complexities that often accompany scientific progress. The journey of anesthesia underscores the delicate balance between innovation and the moral responsibilities that come with it. Before anesthesia, surgery was as much about speed as it was about skill. Surgeons had to be incredibly fast, often racing against the clock to complete procedures. Surgeons were under immense pressure to operate quickly, minimizing the patient's agonizing experience. Every second counted, and hesitation could mean the difference between life and death. This often meant sacrificing precision for haste, leading to complications and infections that further reduced the chances of survival. The lack of sterile techniques only compounded these issues. Amputations, for instance, were notoriously swift and brutal, with surgeons aiming to remove a limb in under a minute. The speed was necessary to reduce the patient's suffering, but it came at a high cost. Post-operative recovery was just as harrowing. Patients faced excruciating pain without the relief of modern painkillers. Patients, often delirious from pain and trauma, would writhe in agony, their wounds vulnerable to infection. The risk of sepsis was ever present, and many did not survive the recovery period. The psychological toll was immeasurable. The trauma of the experience left deep emotional scars. Many patients carried the mental scars of their ordeal long after their physical wounds had healed. The fear and anxiety associated with surgery were profound. The advent of anesthesia promised to change all that, to transform surgery from a terrifying ordeal into a more humane and effective practice. It marked the beginning of a new era in medical history, offering hope and relief to countless patients.